You and I know what is at risk, how to take care of ourselves. But poor and vulnerable people don't have that knowledge. My name is Dr. Angela Chaudhuri. I used to be an oral surgeon. I'm a public health specialist, also a journalist. So I wear many hats, and I lead an organization called Swasti. Back in 2003, 2004, India was going through one of its worst tides of the HIV epidemic, and it was mostly affecting gay men, transgender populations, and women in sex work. And the programs there were largely about testing for STIs, sexually transmitted infections, and HIV, convincing them to wear condoms every time they had a sexual contact, and other things. And of course, they were very stigmatized. But when we got into the room, it's a room about this large size, just the small. All of us sat on the floor, looked at each other and said, hey, what does well-being really mean to you? I was surprised as a young professional that health was not even the top 5 of their requirements. It was really safety from violence. It was livelihood. Do we have the next meal at our table? Are our children safe? Am I going to get beaten up today? Am I going to get raped? Am I going to be jailed and then exploited? All of those things were much ahead of health. And so we had a challenge when the whole world was professing use of condoms and testing for STIs. The women really wanted something else. So despite a lot of oppositions from donors and the environment who thought we were really stupid, our action was building agency and empowerment with these women. It meant that we moved our programming to preventing gender violence. We moved our programming to advocating with the cops so that they could be their protectors and not the perpetrators. It meant livelihood options. It meant safety, security, and justice. And when the women saw that they had a right to live and that they had a right to well-being and they had a right to be happy, they automatically took care of themselves. We work with the communities and community champions. We are situated on the ground. We have partners that have been there for years. So trusting proximal leaderships and not swooping down from the top is how we really work with those champions. And they call people. But that's just the power of conversation, communication, understanding, learning, and co-designing programs through trusted and proximal leadership. We need to continue to work with ecosystem players and unlock resources that are available, continuously listen and co-design and locally innovate solutions, and communicate, and share gracefully and extravagantly so that other communities can pick them up and have solutions of their own.